Welcome to University of Wisconsin-Madison Division of Extension's training on public health as it relates to COVID-19 and the current pandemic. During this video, we will be introducing you to some basic public health information as it relates to the COVID-19 virus and current pandemic. In this first section, we will cover the following topics. What is COVID-19? Symptoms of COVID-19. People who are at higher risk for severe illness, and where to find additional resources. As to what is COVID-19, the U.S. Centers for Disease Control provides the following information on COVID-19. COVID-19 is a new disease caused by a novel or new coronavirus that has not previously been seen in humans. There are many types of human coronaviruses, including some that commonly cause mild upper respiratory tract illnesses. However, the virus causing coronavirus disease 2019, also known as COVID-19, has not been seen previously or previously identified. It is not the same as the coronaviruses that commonly circulate amongst humans and cause mild illnesses like the common cold.
People with COVID-19 have had a wide range of symptoms reported, ranging from mild symptoms to severe illness. Symptoms may appear 2 to 14 days after exposure to the virus. Anyone can have mild to severe symptoms. Older adults and people who have severe underlying medical conditions like heart or lung disease or diabetes seem to be at higher risk for developing more serious complications from COVID-19 illness. People with these symptoms may have COVID-19: fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, diarrhea. Look for emergency warning signs for COVID-19. If someone is showing any of these signs, seek emergency medical care immediately. Trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, bluish lips or face. This list is not all possible symptoms. Please call your medical provider for any other symptoms that are severe or concerning to you. Call 911 or call ahead to your local emergency facility. Notify the operator that you are seeking care for someone who has or may have COVID-19. Based on what is currently known, those at high risk for severe illness from COVID-19 are people 65 years or older, people who live in a nursing home or long-term care facility, people of any age who have serious underlying medical conditions, people of all ages with underlying medical conditions, particularly if not well controlled, including people with chronic lung disease or moderate to severe asthma, people who have serious heart conditions, people who are immunocompromised. Many conditions can cause a person to be immunocompromised, including cancer treatment, smoking, bone marrow or organ transplantation, immune deficiencies, poorly controlled HIV or AIDS, and prolonged use of corticosteroids and other immune-weakening medications. People with severe obesity, body mass index, BMI, of 40 or higher, people with diabetes, people with chronic kidney disease undergoing dialysis, people with liver disease. For additional information on the COVID-19 virus, we recommend the Centers for Disease Control's What is Coronavirus FAQ and insights from Johns Hopkins University. For recommendations on safe handling of fresh produce, please visit the Extension Safe Food site at fyi.extension.wisc.edu/safe food. These links, along with all sources, will be available on the Extension COVID-19 website at fyi.extension.wisc.edu/COVID-19.
Let's do a knowledge check. Of these people, who are at the highest risk for developing a severe case of COVID-19? Choose 3. People 65 and older, people with diabetes, children, pregnant women, or people with asthma. The 3 that are most likely to develop the highest risk of a severe case of COVID-19 are people 65 and older, people with diabetes, and people with asthma. At this time, medical science has actually shown that children are at the lowest risk of developing a severe case of COVID-19.
This section will cover personal prevention practices you can use to help stay safe from COVID-19. These include social physical distancing, hand washing, disinfecting, and face coverings. In publicly accessible areas, it is important to practice physical social distancing to stop the spread of COVID-19. According to the CDC, here's why. COVID-19 spreads mainly among people who are in close contact within about 6 feet for a prolonged period. Spread happens when an infected person coughs, sneezes, or talks, and droplets from their mouth or nose are launched into the air and land in the mouths or noses of people nearby. The droplets can also be inhaled into the lungs. Recent studies indicate that people who are infected but do not have symptoms likely also play a role in the spread of COVID-19. It may be possible that a person can get COVID-19 by touching a surface or object that has the virus on it and then touching their own mouth, nose, or eyes. However, this is not thought to be the main way the virus spreads. COVID-19 can live for hours or days on a surface, depending on factors such as sunlight, humidity, and the type of surface. Social distancing helps limit opportunities to come in contact with contaminated surfaces and infected people outside the home. Although the risk of severe illness may be different for everyone, anyone can get and spread COVID-19. Everyone has a role to play in slowing the spread and protecting themselves, their family, and their community. Tips for social distancing. Follow guidance from authorities where you live. If you need to shop for food or medicine at the grocery store or pharmacy, stay at least 6 feet away from others. Also, consider other options. Use mail order for medications if possible, or consider a grocery delivery service. Cover your mouth and nose with a cloth face covering when around others, including when you have to go out in public, for example, to the grocery store. Cloth face coverings should not be placed on children under the age of 2. Anyone who has trouble breathing or is unconscious, incapacitated, or otherwise unable to remove the mask without assistance. Keep at least 6 feet between yourself and others, even when you wear a face covering. Why, when, and how to wash your hands. Hand washing is one of the best ways to protect yourself and your family from getting sick. Learn when and how you should wash your hands to stay healthy. Washing hands can keep you healthy and prevent the spread of germs from one person to the next. Touching your eyes, nose, and mouth with unwashed hands will spread germs. Preparing or eating food and drinks with unwashed hands will spread germs. Touching a contaminated surface or objects with unwashed hands will spread germs. Coughing, sneezing, or blowing your nose into your hand, then touching other people or objects with your unwashed hands will spread germs. During the pandemic, keeping hands clean is especially important to help prevent the virus from spreading. Washing your hands is easy, and it's one of the most effective ways to prevent the spread of germs. Clean hands can stop germs from spreading from one person to another and throughout an entire community, from your home and workplace to childcare facilities and hospitals. Follow these 5 steps every time. Number 1, wet your hands with clean running water, warm or cold. Turn off the tap and apply soap. Number 2, lather your hands by rubbing them together with the soap. Lather the backs of your hands, between your fingers, and under your nails. Number 3, scrub your hands for at least 20 seconds. Need a timer? Hum the happy birthday song from beginning to end twice. Number 4, rinse your hands well under clean running water. And number 5, dry your hands using a clean towel or air dry them. Washing hands with soap and water is the best way to get rid of germs in most situations. If soap and water are not readily available, you can use an alcohol-based hand sanitizer. Sanitizers must contain at least 60% alcohol. You can tell if the sanitizer contains at least 60% alcohol by looking at the product label. Sanitizers can quickly reduce the number of germs on hands in many situations. However, sanitizers do not get rid of all types of germs. Hand sanitizers may not be as effective when hands are visibly dirty or greasy. Hand sanitizers might not remove harmful chemicals from hands like pesticides or heavy metals.
Wear reusable or disposable gloves for routine cleaning and disinfection. Clean surfaces using soap and water and then use disinfectant. Cleaning with soap and water reduces the number of germs, dirt, and impurities on surfaces. Disinfecting reduces germs on surfaces. Practice routine cleaning of frequently high-touch surfaces. High-touch surfaces include tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, and sinks. For disinfecting, use EPA-registered household disinfectant. Follow manufacturer's instructions on how and where to use it. You could also use a bleach solution. Mix 4 teaspoons of bleach per quart of room temperature water. Next, wipe down surfaces. Leave the solution on the surface for at least 1 minute. Bleach solutions will be effective for 24 hours. 70% or greater alcohol may also be used. For soft surfaces, such as carpeted floor, rugs, and drapes, clean the surface using soap and water or with cleaners appropriate on these surfaces. Launder items, if possible, according to the manufacturer's instructions. Use the warmest appropriate water setting and dry items completely. Or disinfect with an EPA-registered household disinfectant and vacuum as usual. For electronics such as tablets, touchscreens, keyboards, and remote controls, consider putting a wipeable cover on electronics. Follow the manufacturer's instructions for cleaning and disinfecting. If no guidance, use alcohol-based wipes or sprays containing at least 70% alcohol. Dry surfaces thoroughly. For clothing, towels, linens, and other items, launder items according to the manufacturer's instructions. Use the warmest appropriate water setting and dry items completely. Wear disposable gloves when handling dirty laundry from one person who is sick. Dirty laundry from a person who is sick can be washed with other people's items. Do not shake dirty laundry. Clean and disinfect clothes hampers according to the guidance above for surfaces. Remove gloves and wash hands right away. Some key times to clean hands: immediately after removing gloves and after contact with the person who's sick, after blowing one's nose, coughing, or sneezing, after using the restroom, before eating or preparing food, after contact with animals or pets, before and after providing routine care for another person who needs assistance, someone like a child. Just as a reminder, the most effective way to prevent the spread of germs is to wash your hands frequently and effectively. Follow these 5 steps every time. 1. Wet your hands with clean running water, warm or cold. Turn off the tap and apply soap. 2. Lather your hands by rubbing them together with soap. Lather the backs of your hands, between your fingers, and under your nails. 3. Scrub your hands for at least 20 seconds. Need a timer? Hum the happy birthday song from beginning to end twice. 4. Rinse your hands well under clean running water. And 5. Dry your hands using a clean towel or air dry them. If soap and water are not available or practical, you can use hand sanitizer as an alternative. That said, hand sanitizer should contain a minimum of 60% alcohol. If your hands are dirty or greasy, always wash them with soap and water. In addition to washing your hands, you can minimize the spread of germs by not touching your eyes, nose, and mouth with unwashed hands. Refrain from touching your face covering and practice proper health etiquette. Cover your sneeze or cough in your elbow or with a tissue. If someone in your household is sick, you'll want to think about ways to try and contain the spread of germs. Keep a separate bedroom and bathroom for a person who's sick, if that's possible. The person who is sick should stay separated from other people in the home as much as possible. If you have a separate bedroom and bathroom, wear disposable gloves and only clean the area around the person who is sick when needed, such as when the area is soiled. This will help limit your contact with the person who is sick. Caregivers can provide personal cleaning supplies to the person who is sick, if that's appropriate. Supplies include tissues, paper towels, cleaners, and EPA registered disinfectants. If they feel up to it, the person who is sick can clean their own space. If sharing a bathroom, the person who is sick should clean and disinfect after each use. If this is not possible, the caregiver should wait as long as possible before cleaning and disinfecting.
The CDC recommends that everyone wear cloth face coverings when leaving their homes, regardless of whether they have fever or symptoms of COVID-19. This is because of evidence that people with COVID-19 can spread the disease even when they don't have any symptoms. Cloth face coverings should not be placed on young children under age 2, anyone who has trouble breathing or is unconscious, incapacitated, or otherwise unable to remove the mask without assistance. COVID-19 spreads mainly from person to person through respiratory droplets produced when an infected person coughs, sneezes, or talks. These droplets can land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs. Studies and evidence on infection control report that these droplets usually travel around 6 feet, about 2 arms lengths. While people who are sick or know that they have COVID-19 should be isolated at home, COVID-19 can be spread by people who do not have symptoms and do not know that they are infected. That's why it's important for everyone to practice social distancing and wear face cloth coverings in public settings. Cloth face coverings provide an extra layer to help prevent the respiratory droplets from traveling in the air and onto other people.
Correctly wearing your face covering is important for your health and safety and the safety of those around you. 1. Wash your hands before putting on your face covering. 2. Put it on over your nose and mouth and secure it under your chin. 3. Try to fit it snugly against the sides of your face. And 4. Make sure you can breathe easily. Wear a face covering to help protect others in case you're infected but don't have symptoms. Keep the covering on your face the entire time you're in public. Don't put the covering around your neck or up on your forehead. And finally, don't touch the face covering, and if you do, make sure to wash your hands.
Be careful not to spread any unwanted germs when you get home. Removing your face covering carefully is a key to staying healthy. 1. Untie the strings behind your head or stretch the ear loops. 2. Handle only by ear loops or ties. 3. Fold outside corners together. 4. Wash or sanitize your face covering. 5. Be careful not to touch your eyes, nose, and mouth when removing your face covering. And 6. Wash hands immediately after removing it. Wash your face covering frequently, preferably after each use, and have multiple face coverings if possible.
Let's do a quick check for understanding what we have learned so far. Which of these are good tips for preventing the spread of COVID-19? Stay at least 6 feet away from others when outside of your home. Avoid gatherings of any size outside your household, including children having in-person playdates. Cover your mouth and nose with a face covering when you have to go out in public. All of these. All of these are good tips for prevention, as well as washing your hands properly and regularly.
True or false? Hand sanitizer is just as effective in reducing germs as washing hands with soap and water. False. Sanitizers do not get rid of all types of germs and may not be as effective when hands are visibly dirty or greasy.
True or false? Face coverings are primarily worn in order to prevent spread by those people who may carry the virus unknowingly but do not have symptoms. True, a cloth face covering may not protect the wearer, but it may keep the wearer from spreading the virus to others.
The information provided in this training is based on current CDC guidelines and recommendations. You can find more information by visiting us at our website at fyi.extension.wisc.edu/COVID-19. In addition, please note that COVID-19 pandemic is ongoing and things are changing, so where possible, please visit the CDC website for additional updated information.